Hello everyone, my name is Jeramin Kablay and I will be presenting to you information about cocaine. So what is cocaine? Cocaine is a fine white crystalline powder that's an addictive stimulant drug. It can be known as coke, crack, snow, or rock. It is classified as a Schedule II drug because it still has medical purposes even though it has a high potential for abuse. It can be used for local anesthesia for some surgeries, but recreational use of this drug is illegal. It is from the coca plant leaves native to South America. The leaves were chewed or ingested because of its stimulant effects. According to the American Addiction Centers, around 14 to 21 million people worldwide actually used cocaine. In the early 1900s, it was actually part of the ingredients in the soda Coca-Cola. So, how is it used? Cocaine can be snorted through the nose, as shown in the picture on the right, or a person can also rub it in their gums. The dissolved powder can also be injected into their bloodstream. Lastly, it can be smoked as well. And users typically take it repeatedly to maintain the high. In terms of the effects on the body, cocaine use increases the dopamine levels in between two nerve cells in the body, which causes it to build up in that area. The neurotransmitter dopamine is actually prevented from returning back to the nerve cells that released it. The excess dopamine leads the brain to be less sensitive to rewards, which then causes the user to feel the need to use more cocaine. Other effects include having dilated pupils, such as shown on the picture on the top, being restless, having an increased body temperature, blood pressure, and having fast or irregular heartbeat. These effects can last from a few minutes to an hour. The length of the effects is actually dependent on how the drug was used. There are short-term and long-term effects of cocaine use. Short-term effects may include happiness, irritability, alertness, hypersensitivity to sound and sight. Long-term effects may be having frequent runny nose from snorting cocaine consistently, developing asthma from smoking it, having bowel decay from consuming it via the mouth, or having scarring or collapsed veins from the repeated injections. The use of cocaine has risks and consequences as other drugs usually have. This includes the possibility of overdosing, having a seizure, a stroke, HIV infection, having high blood pressure, memory loss, and/or having a brain shrinkage. In terms of treatment, behavioral therapy is typically used for treating cocaine addiction. This includes partaking in cognitive behavioral therapy or having motivational incentives, which is when the patient receives rewards for not using the substance. The user can also participate in a community-based recovery group, such as the 12-step program, which is designed to help the person recover from their substance addiction. Even though there is no specific medication that can treat cocaine use, there are other treatment options, such as those that were previously mentioned, that can help the individual deal with their addiction. And here are the references that I've used, and thank you for watching.